Los Angeles, California, our second branch. I want to go ahead and take this, what I would say, a spontaneous Facebook Live.
Yes.
And you were nice and generous to share your journey. I remember when I talked to you, you said I listened to the other patient, and because I listened to the other 89-year-old patient, she can do it, I can do it too. And I remember it was not too long ago that I talked to you. You are 83 years old and you have implants from 1983.
Yes.
So 83 and implants from 1983. You want to hear something interesting? I talked to a lady 2 weeks ago. She was 88 and she had implants from 1988. So I thought that
Yes.
was very interesting.
Right.
That what are the odds that I'm talking to
Yeah,
83 and
83.
in 1983. So now we want to hear from you. How did you know this is breast implant, unless that you need to get this done? Because at your age, you're like playing with grandkids, Like
Yes.
what is going through your mind? Why do you want to remove your implants now?
So when I got my implants in, it was many years later that I started hearing about implant rupture and implant failure. And I just thought to myself, oh, I'm so lucky that the doctor who put mine in used the best implants and I haven't had a problem. And it never occurred to me that they could be failing and I wouldn't even know it.
You were not
So-
told that they're not lifetime devices.
Never told that. No, but this in 1983, I don't know whether they even were thinking like that.
Mm.
But so then I started having a lump over on my right side that was kind of close to my underarm. And I told myself that I had a shoulder issue. And I just thought, oh, that's my shoulder. I pulled another muscle in my shoulder. So I had had this discomfort for quite a while. I can't believe it. I'm a nurse. I can't believe that as a nurse, I never connected that this could be implant illness, implant failure.
Mhm.
So then on my left side, I developed a little lump under my left breast. So I went to my PCP. She sent me for an MRI of both breasts, and they said these implants are leaking and ruptured.
You know what is very interesting is you had a biopsy done of a lesion here. As soon as they made the cut, they found silicone pouring out. Explain
Yes,
that.
yes. So I had it looked like a blackhead, and I kept squeezing it, and it just wouldn't go away. And so I felt like it was unsightly, and I just wanted to get it off. So I went to a dermatologist, and they excised it. But when he went in, he said, I don't know what this is, but there's no end to it. He said, I keep pulling and there's still more there. It didn't even occur to me that it was silicone.
It was
So-
silicone, active
Yeah.
slime.
Yes.
Because
Exactly. And he didn't recognize it and I didn't recognize it and they just closed me up.
yes,
So-
because the reasoning behind that is at the lower part, you told me in pre-op, and the patients know everything, by the way. You basically said this cut right here, there was silicone coming out of this one at the bottom. And so I want you to go see the Facebook Live I did a couple days ago, and you'll see exactly where this outpouching is, where the incision was at the bottom, where you
Yes.
had another biopsy done, and literally it was coming up to the level of the skin. And this is where your dermatologist found that the silicone was not only within the capsule, but extra capsular.
Yes.
And that was, you made the cut and silicone actively, grossly, visually was coming out.
Right. It actually worked its way outside the skin.
Yeah.
So then, about 2 years ago, when I had the MRIs done, then I was faced with the reality that this is what it is and something's got to be done about this. So then I kept rationalizing that I'm 81 years old. Do I really want to do this? How many more years can I live? But it was getting
100 more years.
that's how I feel today.
Yeah.
But it was getting more and more troublesome. So I not only had the pain on the right side under my arm, but both breasts were starting to hurt. They were just uncomfortable all the time, sometimes with pain, but 24 hours a day they were uncomfortable. When I went to bed at night, I would have to place myself a certain way in the bed so that my chest wouldn't hurt. And
So
then-
when did you know that? So you had the MRI done, you had the biopsy that was putting out silicone. At what time did you know that, you know what, I have to go ahead and get these removed? Like, when did you decide?
Oh, so I think it was my daughter who decided. She decided about 6 months ago, and she started doing research, and she found you.
Mhm.
And she said, Mom, I've looked at all these doctors, and I really think that this is your doctor.
Mhm.
So then she started talking to me about you, and I still wasn't convinced that I should go through this. And my daughter, she does everything for me. She made all the arrangements. She makes it so easy. The
Can I say something? When she was young, you did everything for her. Now she has to do everything for you.
well, she really does.
Yes, yes, yes.
So she made the decision easy. And the one thing so then when she went onto Dr. Khan's website, she saw that there was an 89-year-old woman who had been explanted.
Mhm.
And she took that to me and she said, Mom, you don't have to live this way.
Mhm.
And that was it. The decision was made right there.
Mhm. No, I remember it was not too long ago that I talked to you, and I have to say, your daughter had done all the homework. So it made it, this is part of that informed consent,
Yes.
right? As a
yes.
nurse, you knew exactly what you were signing up for. And you knew going into the case what were the expectations. Now, let me ask you this: how was your anesthesia experience?
Oh, Dr. Almar.
Lamar, yeah.
Oh, he is the best anesthesiologist I've ever had. I've had a few surgeries in the past, which is understandable given my age. I always had intractable vomiting, and I told Dr. Almar that ahead of time. I came out of surgery feeling absolutely fine.
He's a magician.
He's the nicest man. He's just as nice as you are.
Mhm.
You are a great team.
Yeah.
It was such an easy experience. So I was nervous about it. I mean, this is something that would make anybody
And you
nervous.
were done just upstairs here at the Landmark Surgery
Yes,
Center.
here at Landmark.
We did not have to go to the hospital.
No.
And I have to say, your daughter did a phenomenal job communicating with me, the whole pre-op clearance, the feedback from your doctor. Obviously, it helps. You're a nurse, you understand, we are on the same page. You are as sharp can get, and it was very easy to communicate because we knew exactly what was going to happen next year.
And I should mention, my daughter also found other doctors who were within a reasonable distance that we could have gone to. And actually some who do a lot of explant surgery, and some who we would not have had to board a plane for.
Mm.
So we really did consider several other doctors. And I have to tell you, I am so happy that we came to Michigan.
No, thank you.
I can't say enough about this experience.
No,
It's been
thank
wonderful.
you. How was your pain post-op?
Oh, so my pain post-op, on the first day, I took a half a tramadol. And then later on towards the evening, I took a Tylenol. And then the second day I took 2 Tylenol. And the third day I took 1 or 2 Tylenol. And now today is the 4th day and I haven't taken anything.
Sure, and and you got the Exparel as well, so that certainly helps.
Oh, yes, the
Yeah,
Exparel.
yes, yeah. So we do not know if this is the Exparel effect, but most of the patients, almost 70-80% patients are in your category. Now, I want to say there are a lot of patients, I use the word millions of patients, who have ruptured implants and they do not know they're ruptured. Remember, according to the guidelines, if you look at the FDA, but look at, let's say, Mentor, they tell you get an MRI at year 3, and then every 2 years they're onward looking for a silent rupture.
Mhm.
Remember, it is not healthy, not normal to get a ruptured implant and be living with it. You need to remove not only the implant, but the capsule, but the whole as a shell. and the inflamed. So this is the take-home message. Anyone knows, remove the implant and the capsule and the inflamed tissue as en bloc or a total capsulectomy, so that that silicone that has leached into the periphery, that has to be removed as much as the silicone that is intra and extra capsular.
I know that, and I didn't really believe that it could be done,
Uh,
and you have done it.
No, I will tell you, if you, Marlena will post the video from the operating room, the Facebook Live we did. And
Yes.
thank you very much for sharing your journey, because just like that other nice 89-year-old lady, she started this amplification cascade, if you will, where other patients are going to learn. They're
Yes.
going to learn from you. Your words are going to change other people's lives, and that is very strong.
Yes, if I can inspire one person even to come and have this surgery. I'm only on day 4 since my surgery, and I feel like a new person.
You can only imagine, if you see what was taken out, how much healthier you're gonna feel. Now, what have you noticed, if anything, different? Now, the moment I saw your face, you definitely looked healthier. Now, I did not know if it's, over here in Michigan, we say pure Michigan. That's
Yeah,
our slogan.
That could be.
Yeah. But this is where, your hours out, literally.
Yes.
What we will do is, in the 5 month, 6 month mark, we want to continue to hear from you, so that we know initial post-op what happened, and then 6 months later what happened, so that not only the patients, but the other plastic surgeons, the primary care doctors,
Yes.
emergency room doctors, family members,
Yes.
sons and daughters. I have a patient right now in the other room. She worked for a plastic surgeon, so she knew exactly, also a nurse.
Yes.
I wish I could go back, and I was telling Mar and find out how many of our patients are nurses and in the medical field, and they have done their due diligence, informed consent, and just go to the pictures and the videos so you can see for yourself, because this is truly part of informed consent.
Yes.
Uh,
So I'll tell you, my surgery is done on Tuesday. This is Friday. And I woke up during the night on Tuesday, and I realized that I was able to flex my fingers. I do have arthritis, but my fingers were at a point where I almost was losing the use of my fingers. And it was so surreal that I was lying in bed and my fingers were flexing better than they have,
Wow.
that I can even remember. And then while I was lying in bed, I realized that I had my hearing aids in place. And I drive my family crazy with the hearing aids, because I put them in when I have to hear, and then they're always irritating my ears, so I take them out. I put them in and I take them out. And here I was sleeping, my hearing aids were in my ears, and there was no irritation. So could that be connected?
We will
I
ask
don't-
at the 6 month mark,
Exactly.
because again, this is too early. We see, what we want to do here is, we want to establish, why is it that you would come here to Michigan in the middle of winter?
Yeah.
And literally, I think it was snowing pretty bad that day, right? And
Yes,
the next,
it was-
and this is where you knew what you had signed up for, and this is that complete transparency. And I say this to each and every single patient: the listen to what I have to say, very important, because remember, I'm directing this start to finish, but most importantly, see the high definition pictures and videos of the chest wall.
Yes.
I'm going to say it again. Not only the cutting open of the implant capsule on the table, but look at the high definition pictures and videos of the chest wall, your own chest
Yes.
wall, so you can see exactly how the surgery was done, why it was done, and the manner it was done.
Well, when I saw those pictures, they're kind of startling, but as a nurse, again, that helps me, because I see how clean that opening was, and it was so impressive. And I didn't even think about that before I came here, but I think about it now. It's remarkable.
Yeah, we gave the pictures right in recovery to the wonderful, nice daughter, and so she had a chance to see as a nurse. And so this is where it is, what I use the word complete transparency, so that as you head back home, you have a flight to catch this afternoon. So
Yes.
I know I made you wait a little bit. No, thank you very much for sticking around. and
My
doing this
pleasure,
Facebook Live
really.
and,
Yeah.
you know, safe travels. I will let you finish. Please say anything to anyone in regards to any message, anything you want to share with anyone.
Well, I do think that any woman who is considering this, move forward a little more quickly than I did, because I did have years of anxiety and, not being sure. And I feel so grateful that I found Dr. Khan, and Dr. Alamar, who is also wonderful, and that I've been able to come out of this feeling so refreshed and healthy and hopeful. It's been a really good experience.
No, thank you. Safe travels. All the very best.
Yes,
Uh,
thank you.
You're
Thank you,
welcome.
Dr.
You're
Khan.
welcome.
You know, I mean it from the heart.
No, I will tell
Yeah.
you, this is what drives me every day.
Yeah, yes, you did say that once. You said, how many people get up in the morning and love what they do? I'm one of those
Yeah.
people. Yes, I could tell that
No,
drives you.
thank you. I appreciate it.
Yeah.